Welcome to this amazing evening and a very glamorous night. On behalf of Novacure and my colleagues that are here tonight, all of you put the patient at the heart of everything that you do. The caregiver role that many of you play, the provider role that many of you play, and we're here to celebrate what each of you do on an everyday basis.
When you look at what our heroes have done tonight for the people who have come after them and the people diagnosed with brain tumors, it's just incredibly heartwarming. And those of you from Novacure who spend that time getting what they're finding into a drug or some kind of treatment that can save their life, we really honor you too.
After 17 years of working around the clock, I was diagnosed with a brain tumor. And the ugliest of ironies, my mom, an even harder working female, was also diagnosed with a brain tumor just 8 months earlier. I can't stress enough how important it is to have resources like Cure to help us, especially today. The survivors are my inspiration, and the heroes that we're about to award are my inspiration. And so I want to say thank you for helping people like my mom. And so your work is incredibly important, and I want to thank you for having that passion to help all of us.
What can I do to help you? That's a common question. Tell me what I can do to help. Tell me what I can do to help. We hear that often, and we ask that often. Head for the Cure is the answer to the question. You show up. So the ultimate goal is our positioning line, and that is to defeat brain cancer step by step.
Through Matt's direct leadership, Head for the Cure is celebrating 15 years of supporting the brain cancer community.
Life without hope is life without joy. Head for the Cure was born with a promise I made to my brother. He believed the presence of his GBM could best be rationalized by his privilege to help another person, a person facing the same struggle.
Well, the hopes are that with the results of our phase 3 trials and other subsequent trials, as well as some concurrent trials we're doing, we'll be able to gain more information on, for instance, which patients respond and which patients don't, so that we hopefully can find biomarkers of response for these more novel treatments.
Told me I only had 17 months to live. I was unwilling to accept this diagnosis. So I sought out the best doctor and clinical trial I could find, which led me to Dr. Liao and her GCVAX clinical trial. And I'm here tonight because of Dr. Liao. I don't mean I'm here to honor her. I mean I'm actually alive tonight because of Dr. Liao.
Thank you all for being here. It's very humbling.
I think the most exciting thing has been seeing all the collaborations that have come forth and seeing how close to clinic research projects are, and especially when it comes to some of the mechanisms of the disease.
She has been instrumental in creating a brain tumor support group in Northeast Florida that has served more than 170 patients since it was founded 10 years ago. We want to honor Kay Verbal.
You know, it's just such an honor to work with brain tumor patients, and if there's anything that Brain Tumor Network can do for any of your patients, we'd love to help.
All these patients that we've been helping, most of them are relatively poor. So I created a co-payment assistance program where, with the idea being, we would help with that first initial deductible. And then once we got past that, the insurance would usually pay for the rest of the year.
Several years ago, Optune had just been approved, and I had a patient who desperately wanted to go on it. And we petitioned their insurance company, and they said no. But my patient was able to have this therapy because of his work. And this isn't just an abstract idea, but it's an actual person whose life he's touched. And we're so grateful, and I couldn't think of a better person to honor tonight than Dr. Al Mazzella.
Thank you, Ashley. That was very nice. I'd like to thank everybody, Novacure, Cure Magazine, and especially my family, my wife, and my son is here.
And I want to leave you with one word. It's a word that came to my mind as I thought about tonight, and that's perspective. I think Maria said it best in her speech tonight, and going through something like cancer puts in perspective what matters.
First, I'm very honored to be recognized as a GBM hero. I'm sure that it's common amongst the other honorees that no one does this for the glory. We do it for the purpose purpose.
We as funders can continue doing our work that's important to us and yet still reach out and collaborate with others and do something that's for the greater good.
I feel so privileged and grateful to be honored by this award. This comes from, individual patients, and I think that's just, incredibly meaningful.
Oh, it's an amazing event because we never really do get recognition. Nobody knows what we do, and nobody knows what all the other winners have been doing either. This is a way to get it known of what we're all doing, and it's amazing to be considered as part of the other 3 winners. I always thought of them as such high level, and it's an honor to be put in with that group of people.